A focus on the most vulnerable. The province unveils its plan to vaccinate hundreds of thousands of Albertans. Now that all residents in long-term care facilities are fully immunized from the COVID-19 virus, the next stage in the rollout plan is revealed, and it continues to prioritize age and underlying health conditions.
We're now ready to expand vaccinations to all seniors aged 75 years of age and older.
Starting today, AHS will make the vaccine available directly to seniors living in residential facilities or lodges. Next week, those born in 1946 or earlier can make appointments online or by the phone to get immunized.
Since the vaccines began in long-term care centers, that the number of infections, of outbreaks, of hospitalizations, and of fatalities coming from long-term care has fallen dramatically.
Phase 2 of the rollout, which is slated to begin in April, is broken down into 4 groups and would cover roughly 1.8 million Albertans, starting with seniors aged 65 to 75 and First Nation and Métis people aged 50 to 64. Then followed by people aged 18 to 64 with underlying health conditions, a list that is still being worked out. The next group is residents and staff in congregate living areas like prisons or homeless shelters, as well as healthcare workers and caregivers of those with high-risk outcomes. And the final grouping is all Albertans aged 50 to 64 and First Nation and Métis people aged 35 to 49. For people who work in public-facing jobs not covered in Phase 2, like teachers, police, and grocery store workers, Premier Kenney has this to say.
With a limited amount of vaccines, we must make difficult choices to ensure that those people who are most at risk are protected first, following the data and the scientific advice.
Phase 3, which would open up to the general public, would begin in September. Kenney says the inoculation of those in long-term care has helped bring our fatalities and hospitalizations down, and so too have the restrictions in place, measures that will be looked at next week by the COVID Cabinet Committee.
If we were to see in the next couple of weeks a very steep, a significant increase, I should say, in new cases and the positivity rate and the rate of transmission and hospitalizations, then we would delay step 2 of the path forward. If, however, we remain more or less where we are now, or see continued decline in hospitalizations and those other numbers, then I anticipate moving forward on, as you say, in the first week of March.
Meantime, the opposition NDP not pleased with the plan released today.
Jason Kenney's announcement was late, was lacking in detail, and it failed to address the very credible threat posed by new COVID-19 variants.